Hey everyone, in this episode, I'm going to be revealing a lot of my postpartum anxiety that I experienced and how it developed even before I became pregnant. Hopefully carry some lessons that will help you better understand what postpartum anxiety can look like and maybe what to do about it. And hopefully it'll be fun for you to just kind of hear my experience and understand maybe how to prepare for yourself or how to see in other people that you know who are about to be postpartum. I'm also going to be continuing on from last week. I talked about how Janie had bit me while we were nursing, and I'm going to share kind of my healing journey the last week and what that's been like. And then I'm also gonna, at the very end, I share a spiritual insight for those battling their fears, whether or not it's postpartum related. It can also be related to just anxiety in general or any struggles that you have. I just share scripture from the Book of Mormon and invite you to come to Christ. So I hope that you enjoy this episode.
Hey, welcome to the Mommas Lounge podcast, where we get real about the beautiful chaos of postpartum. I'm your host, Camille Perkins, and I'm happy you're here. We're all about authenticity, the highs, the lows, and the unexpected messy middles. We'll find strength in our faith, embrace our diverse experiences, and love without judgment. So, grab your favorite beverage, get comfy, and let's chat.
Hello, everybody. First, we'll start with continuing from last week. So last week I talked about how Janie bit me and that sucks, and it got pretty bad. And I was in a lot of pain, and I was like, I feel you guys. And I want to kind of update you on how the last week has been and what has helped. And yeah, so basically I released that episode on Friday, and then the next day I continued to nurse, and it was the most painful I've ever experienced nursing. And I actually ended up having to take Janie off. And when I looked at the wound, it was bigger, much bigger. And I was really angry, not at Janie, but at myself for allowing me to nurse, because we had kind of decided okay, maybe we shouldn't nurse, maybe we shouldn't. But I had looked at it and it looked like it was kind of better from the night before. So I was like, no, I'll just do it. And it was a bad decision. It ripped off what had healed before and had made the wound deeper. And then by that afternoon, it was definitely infected. Gross, yucky, painful. We hate it, right? So I decided, okay, I need to stop nursing and I'm just going to hand express. And that was fine. Hand expressing for 30 minutes sucks because it takes, 30 minutes of hand expressing to get an ounce or two out. And it kind of leaves, at least for me, my breast feeling a little bruised. But that's what I had to do because I tried pumping and it was also just as painful and it wasn't helping it heal. So I was doing that and I just kept the nipple shield on all day, which, stay tuned, that is not what was helpful. And then on Sunday, I just decided not to go to church and instead go to the Instacare and get it looked at and get some advice. And before I had done this, I had texted a doctor. It was they're a lactation consultant doctor. And it said that you could text them and they can give you an informational call. I ended up missing the call when she had texted me because I was putting Janie to bed for a nap. But I found out that they actually can't give any medical advice over the phone call. It's just a consultation to ask how much it's going to cost with your insurance and what kinds of things they can help you with. And so when I told her my situation and stuff, she was like, okay, cool, I can set up an appointment, but your insurance isn't covered, so it's going to cost you $300. And I was like, and I was like, well, I'll just go to the Instacare. And she warned me. She said, I will warn you, general practitioners don't have any training in nipple care and nipple wounds. That's, something that takes experience to understand how to help with. So just know an antibiotic cream isn't going to be that helpful. There's more to it than that. And I was like, yeah, okay. And at the time I was kind of this person just wants money. I'm sure a general practitioner Instacare doctor can help me. I was wrong. I go in and unfortunately the lady was pretending she knew what she was talking about, but she obviously wasn't, because when I told her my situation and showed her my wound, she was like, yeah, I could just prescribe you an antibiotic. And I was like, okay, yeah, a cream. And that's what I had wanted. And she was like, no, just an oral antibiotic. And I was like, oh, and for me, I didn't want an oral antibiotic because it was a really small spot of my body that wasn't that infected yet, but it was getting there. And I didn't want to ingest a whole bunch of antibiotics because antibiotics, if you've never taken them before, make you feel awful. At least they do for me. They don't make me feel good. And so I was like, I don't really want to do that. And then I was like, so what else could I do to help? She was like, just keep letting it rest. And I was like, okay. And she's like, okay, you'll be better in no time. And I was like, okay. And I remember leaving and being kind of disappointed. Not because she wasn't rude or anything, but because she was like pretending she knew what she was talking about. And it's like, I would have appreciated if she had said, like, I don't have much experience in caring for nipple wounds, like that would have been nice to hear. Because I don't know, I am the kind of person that appreciates transparency. So I left feeling kind of defeated, and I went ahead and researched a whole bunch on Reddit. Because sometimes Reddit can be helpful that way, sometimes not. I researched a whole bunch, and I also actually looked at a couple of articles at reviewing some actual studies and stuff. And this is what I could tell. It looked like saline rinses, which is just water mixed with salt, can be helpful to prevent bacterial infections and kind of get rid of that and keep it clean. And then there's a mix between letting it air dry, letting the wound heal dry, but then it's also really, really good to let it heal wet. And so I decided to just combine all three of those and see what happened. And the next day, it was like 80% less painful, which is crazy because as I was going throughout Sunday, like it was getting worse and worse, bigger, more pussy. Like it was really gross and really painful and awful. So this is what I did. And this is what hopefully if any of you get bit in the future by one of your cute little adorable babies and it's bad enough that you need to like care for it. This is what helped me. I'm not saying it'll help you. This isn't professional medical advice. This is just my experience. So I started doing saline soaks is what I did. So I got like a little bowl and I put just a cup of really warm water with 2 teaspoons of salt, mix that in really, really good. And then I would soak my breast for 8 to 10 minutes, whatever I could handle, because it's really difficult to soak your breast. But I did that. And then after I would do that, I would run it under some warm water under the sink to just make sure it was all clean and get all the salt off. And then I would let it air dry for anywhere from an hour to 3 hours. But while it was air drying, I would just compress my breast and dribble a little bit of milk onto the wound. Hopefully that makes sense. I was basically just hand expressing just a tiny bit of milk, letting it drip on the wound, and then kind of blowing on it and then letting it air dry. And I would do that like every 20 minutes, every 10 to 20 minutes, and I'd do that for 1 or 2 hours. I honestly usually was doing that while I was watching the show. Me and Joe are finally catching up on Andor right now. I don't know if any of you guys are Star Wars fans, but we're still on season 1. So we have the Disney Plus where it still has ads. So every time an ad comes up, I just hand express some milk and let it dry. So that is the first thing that I started doing that I noticed made a huge difference. Like it immediately stopped growing and the pus was way less. So that was awesome. And then the other thing I would do is when I wasn't letting it air dry, then I would keep it inside of a silverette with expressed milk. So I was letting it stay nice and wet and moist, and would just do that like while I was sleeping or, needing to walk around the house and not have my boob exposed. The hand expressing it, just put it in a bottle, and then after feeding Janie on the right side, if she was still hungry, then I'd give her what was in the bottle, because my right side was not prepared to keep up with not having the left side feed every 2 hours, right? So, Janie feeds anywhere from every 2 to 4 hours. It just depends on what she wants. But usually I was swapping between both breasts every few hours. And so when I didn't have the help of my left side, my right side, at one point, there's actually one time that was really sad. I was completely empty, like on my right side, and Janie wanted milk. It had only been like an hour and a half, and I had nothing, and it was so sad. But thankfully I had milk from my hand expressions earlier, and Janie never has been willing to take bottles. She can, but really struggles to. But we finally got her to take a bottle, and I think it was because she was really hungry. And we changed it from a size 4 nipple to a size 3 nipple, so the milk flow wasn't as fast. And again, I think she was just so hungry that she finally took it. But now she's actually taking bottles really well the last couple days with me supplementing, so that's been good. Anyway, so that is what's been helping me. And today's only Tuesday, and I have almost no pain. The wound is definitely still there, but it's much smaller, and you can see it healing bottom to the top, which is how you want it to heal, which is just wonderful. So hopefully that's helpful. If you ever need help with that, you can just plan on doing some saline rinses and let it air dry a little bit and let it, heal while it's wet. So hopefully that's helpful. Okay, so now we're going to get into kind of my postpartum anxiety experience, and this will be different from depression, because I've said this before, I didn't have diagnosed postpartum depression, but I definitely was close. But I won't be talking about that today. I'm going to be talking about anxiety because it came with a lot of things that I learned about myself and about things that can be helpful. So I do want to give a warning. A lot of this anxiety and a lot of these things that I get anxious about are exaggerated and irrational, but that's what anxiety is, right? So I might tell these stories and you might be like, Camille, that was not a big deal. You're right. It wasn't. And I was experiencing a little bit of postpartum trauma, right? And stress and sleep deprivation and like hormones going crazy because I just gave birth. And I think that's something to recognize is when someone's experiencing true anxiety, they're going to be thinking irrationally and things are going to feel catastrophized, exaggerated. And that does not make their struggle invalid though, right? Like, to us, it might not seem that big of a deal, but to them, it is a very real struggle, and we need to respect that and help them and comfort them. And so, as I talk about this, maybe it might feel that way, but I hope that you can see that the reason I'm showing this is to show that if anyone else experiences this, it's valid. It's something that you might experience, and it's something that you can find help for. So really, my story starts before I was even pregnant. I think I have very mild anxiety tendencies. And the reason I think this is because I've kind of always been an anxious person, just a little bit. I mean, growing up, even when I was 10, I think I even took medication for it because I did have like diagnosed anxiety when I was like 10 years old. I would get so scared, I'd scream and freak out over the smallest things. But I grew out of it and I had like almost no problems in high school, no problems into my first and second year of marriage. But towards my third year, just a couple months before I got pregnant, I had a panic attack. And I didn't know that that's what it was. And I would say it wasn't even quite classified as a true panic attack because, again, if you don't know, I graduated in psychology, so I actually know like the actual criteria for a panic attack. And I wouldn't say that I met all of them, but I was getting real close and was just experiencing a lot of anxiety, not just in this one instance, but also just anxiety about my relationships and stuff. I was a Relief Society president at the time, and I was having a lot of ruminations, just overthinking. If you don't know what that word is, ruminating is just basically thinking about things over and over and over again and kind of making stories up in your head, kind of in negative light, and just freaking out that everyone's angry with you, basically. And I was kind of experiencing that as a Relief Society president towards the second half. I just was like so stressed that I was doing everything wrong all the time. And so that made it harder to be my friend, I think. And I am so grateful to all the people who were my friends then and are still my friends. Because I mean, it's very possible that those of you listening are like, I didn't even notice. But oh my gosh, for me at least, it was bad. I was always worried that people hated me and that I was making the wrong decisions. But anyway, so in May of 2023, I got pregnant in September of 2023. So this is quite a bit before. I ended up going to the ER having a panic attack, thinking that I was just sick. And like dangerously sick. So basically I had gotten a yeast infection and I started taking antibiotics and I started feeling awful. And I made the mistake of looking up like the side effects of that medication, and on mayoclinic.org, it's like a medical website, you know, like the side effects are like, if you're having any of these symptoms, go to the ER because you probably have meningitis, is basically what it said. And I had like 3 of them. And I was like, I have meningitis. And I was so scared. I didn't have meningitis, spoiler alert, but I was so scared. I remember like my heart pounding, having that like super scary like adrenaline feeling, you know. And I was talking to Drew, I was like, should we go to the ER? And he was like, I don't know, like, if you really think it's that bad, like, we can go, but it doesn't seem like, you know, you're ill. And so we're like, okay, well, we'll just, like, pray about it and see how it goes. So we decided not to. But then at, like, 11 p.m., 12 p.m., maybe it was 1 a.m., I don't know. It was late in the middle of the night. I couldn't fall asleep, and my heart began to just race. My heart was racing, and it was racing, and it was racing, and I was getting nauseous. And I was feeling like I was going to pass out. Like, I was just feeling so bad. And I was so scared about these feelings. And I was like, I must have meningitis. This is what it is. Like, I'm going to die tonight because I have meningitis. Like, and I was just over catastrophizing. I was like, I can't go to bed tonight because if I go to bed, I'm going to wake up. I'm not going to wake up. I'm going to die because I have meningitis. I was just so freaked out. So Drew was like, no, let's go to the ER because that's what I wanted. I asked him, I was like, let's just go there. And so I remember going to the front desk and kind of telling them my symptoms, and they kind of were like, okay, like, let's get you in. And they all treated it just fine. Like, the nurses were like, okay, well, let's get your blood taken. And by the way, every time I've gone to the ER to get my blood drawn, it's been a horrible experience. Every time I got my blood drawn at the OBGYN, it was great. Like, really no problems. But I just am I think they call it a hard stick. Like, they just can't find my veins ever. But anyways, they ended up blowing my vein out. So, like, they missed my vein and bruised my whole arm. But yeah, so it was just kind of a bad experience in that sense. But they, like, the nurses and stuff were nice. They just were taking forever and not really telling me what was next and how long I should be waiting. They ended up being there for 5 hours. Finally, the doctor comes in, and instead of respectfully telling me, like, hey, like, I think you might be having really high anxiety, right? And telling me, like, you probably are experiencing a little bit of a panic attack. Let's, talk about that and, like, get through it, Instead, he just passive-aggressively treated me like I was crazy. He was like, so you just feel like you should be here? And I was like, yeah, like, I'm just really scared. Like, I think... like, because I read this thing online, and I think I might have meningitis, and he was like, turn your head for me. So I, like, turned my head. He was like, you don't have meningitis. If you have meningitis, you wouldn't be able to turn your head. And I was like, yeah, I know, but, like, maybe I'm developing it, I didn't say that. I didn't talk back to him, but the way that he just talked to me, and then he was like, so, do you come to the ER a lot? And I was like, no, this is my first time in, like, since I was a kid. He just kind of was trying, and again, being someone who was literally that semester studying abnormal psychology, I had gone through all of the different anxieties and mental disorders of people stressing about their health. And anyways, the way that he talked to me just was very much like, I wish I could remember what he said, but he just said some really rude things, and Drew even was like, excuse me? So anyways, we went home literally being told, like, why are you here? And, like, go home. And I just wish they would have told me that as soon as I got to the front desk. Like, your symptoms are obviously fine, Anyways, so that is my first story. But basically, that's kind of where I think my anxiety started to get heightened again. Because I started to, after that experience, I started to, like, ruminate and have anxiety about people I was with and me talking to them, and I would get so scared about Drew taking trips without me. Like, I would just be so scared that he was gonna die, and I just had so much anxiety, basically. Constantly worried all the time. Then we get pregnant in September. In November, 11 weeks in, I bleed, and I was super scared. And I will say, I think it's a good thing I went to the ER. Baby was just fine. But in a situation where you want to make sure that your baby's okay, I think it's important to just go to the ER or to your doctor as soon as you can. I remember sitting down in the ER and them being like, so how many pads have you soaked through? And I was like, I soaked through my pants, but I wasn't wearing a pad. And they were like, okay, like, how bad? And I was like, enough to just soak through. It wasn't like I bled onto the couch or anything, Anyway, so it was kind of obvious from as soon as I sat down and told them that they were like, oh, she's probably fine. Like, she didn't bleed that much. Thankfully, we were able to do an ultrasound, and baby Janie was doing just fine. She actually did a front flip for us on the ultrasound, so she was thriving. We aren't sure why I bled. They actually were worried that I had a, what is it called, like pervia placenta? I'm just barely remembering this, but they were worried that my placenta was too close to my cervix, but it wasn't, thankfully. So that's just an example of where my anxiety was kind of really pushing me over the edge, even early into my pregnancy. So now we're going to just kind of skip over to 8 months pregnant, but just remember, like, this whole time while I'm pregnant, those 8 months, my anxiety, I swear, was getting worse, like, every single day. And I was getting more and more just insecure about myself and about my ability to communicate. And I hated asking for help at this point, but I still would because I knew that I needed the help. And I had some amazing friends who helped me, and I just remember feeling embarrassed about it and trying to hide the embarrassment because I didn't want them to think that they were being a burden. Anyways, I just overthought a lot of stuff. And so then we get into 8 months pregnant, and this happened actually quite a bit. But there was one night where I woke up in the middle of the night and I wasn't wearing my watch, but I counted my heartbeat, like with my fingers, and it was well over 200 beats per minute. And I was just laying there. I hadn't had a nightmare or anything, and it lasted like an hour. Like, it just kept going. I remember, like, sitting up, trying to get it to calm down, doing some breathing, trying to do some mindfulness, and it just continued to stay high. So I think I was able to finally fall back asleep, and then the next morning, Drew and I called the doctor and asked, like, what should we do in the future? And they said, well, if it happens again, and it's to the point where, like, it won't stop, it's lasting for over an hour, you should probably go to the ER. Thankfully, it never happened that bad again. And the doctor also kind of eased my concerns and talked about, like, this is actually kind of normal during pregnancy. It's when it gets, over 220 beats per minute that it's, like, way too high and you need to be getting seen. But I would say that was a development of my anxiety just becoming worse and worse. Although it is normal to have high heart rates during pregnancy, I didn't only have a high heart rate, but I was like so terrified about it. And then I honestly could have had a panic attack if I didn't get help from my husband at that point. So anyways, that happened at 8 months pregnant. A month later, 9 months pregnant, let's see, it was probably 2 weeks before, or even just 1 week before I gave birth to Janie, I had a full panic attack. I remember we were watching a movie, I can't remember what movie it was, and my heart started to race. I was honestly also just feeling super, super sad. And this is probably where my depression started as well. I think it's possible to have prenatal depression, prenatal anxiety. I think this is what I was experiencing. But I was starting to just feel so sad and so uncomfortable. And I think it's because of my anxiety, right? I was so anxious about my friends that I'd feel sad about it. And I'd feel so just uncomfortable in my body that I'd feel sad about it. And I remember just kind of crying to Drew. And at first it just started as like a, wife crying to her husband. We do that. But then the crying just became more and more uncontrollable. And I don't remember what transitioned into the panic attack, but I just remember all of a sudden now we had been in the front room where our TV is, and I can't remember how we ended up on the bed. I think it's because I was in pain and uncomfortable. And so Drew was like, let's have you go to the bed. But it got to the point where I was just like hysterically crying, and it was like I lost control. Like I was totally and completely unable to calm myself down. I was freaking out, and Drew thankfully was just there to hold my hand and comfort me, and I'm just so grateful for him. But I would say that was probably a 100% for real panic attack, right? And it makes me, feel a lot of empathy for those who have panic attacks weekly. Like that is a terrifying experience. And it was over almost nothing. Like I was honestly just crying normally about, how uncomfortable I was in my body. And for context, for those of you who don't know, I had a really rough physical experience with my pregnancy, just like because I had an injury in my hip flexors and adductors, and so carrying Jenny was really difficult. But it was also just like being super swollen, like, your hands, at least for me, my hands got so swollen, and my nose and my cheeks and my feet, and I could feel the swelling constantly, but I couldn't not think about it. Like I couldn't turn it off. And so I was just like always thinking about how swollen my hands were, and it just got to the point where like I flipped out. I just panicked about it. And so yeah, that was really scary. I would say that was probably the hardest part of my anxiety, physically at least. And what I learned is it is super helpful to have a husband or a person that you can rely on when you're in one of those experiences, because I can't imagine going through that panic attack alone. So that might be something good to plan. Like if for some reason you know that your husband won't be able to be there for you, if you have like a sister or a friend that you really trust, maybe you can let them know, like, hey, if I ever experience postpartum or prenatal anxiety really bad, could I count on you for a phone call? Like that might be something good to just plan for eventually, if you think that you would tend that direction. So yeah, that's kind of what I learned with that. The last thing I'll also say about my anxiety before having my baby was prego brain. And I'm sure you've heard of this, pregnant brain. Like, it's hard to think and to make logical decisions and to think through consequences. And that's honestly what I was experiencing, trying to talk with people and interact with people was really hard for me. I had a hard time like thinking through the steps for how I wanted to talk to someone or just things like that. And so I stumbled a lot, and I just remember kind of hating interacting with people because I knew how just awkward I felt in my words and in my mind, but also I was experiencing quite a bit of anxiety about my body and just like body image struggles. And so it was just hard for me to talk to people without thinking about what I must look like to them and thinking about how uncomfortable it was, if that makes sense. Which is sad, and that shouldn't be how we think of ourselves, but at that point that was kind of what was going on in my brain, and it was really hard. So anyways, things to learn from that whole part before I go into the postpartum anxiety. I think the reason that I was struggling so hard, especially, 7 to 9 months pregnant, was because I had stopped exercising. I was still eating really good. Because I'm gluten-free, I've always had to eat really good. And so I think food-wise, I was plenty healthy. But what I was struggling with was exercising. And like I said before, the reason I had stopped exercising was because I couldn't stand for longer than 5 minutes without being in so much pain, and then adding 30 pounds of a baby on top of it. And also when you're pregnant, all of your ligaments become looser, and so your muscles and your tendons struggle to hold you up because your ligaments become looser. It just kind of was an equation for disaster. So because of that, I stopped exercising, and I really believe that for me, this is not a generalized statement, this is for me, exercise is what cures me. It is what saves me, besides Jesus, right? But when it comes to mental health, when it comes to physical body health, and just feeling good about myself and feeling empowered and having energy and sleeping better, it's exercise. So I wasn't exercising hardly at all during this point, besides trying to go on walks, but I would walk for more than 5 minutes and I would be in pain. And so I was just kind of sitting on the couch all day, which made me feel even worse about myself, right? Anyways, I think that's why I had prenatal anxiety so bad, was because first, I have a tendency towards anxiety. I have since I was a kid. And then second, because I stopped exercising. And it's probably the first time in my life where I've stopped exercising that much. So my anxiety was going through the roof at that point because I didn't have anything to manage it. So then I have my baby. And again, I say this every time. That's a story for another day. I will tell you my story one day. But for now, I had my baby. While we're here, I'm going to go ahead and go into what my care routine was postpartum. So my postpartum care routine went as follows. I decided to wear women's Depends, and I'll tell you right now, women's Depends are actually pretty comfortable. At least I thought so. I thoroughly enjoyed as much as you can enjoy wearing a women's diaper. It's obviously not that enjoyable. But it was a better experience than I thought it was going to be. I remember dreading the whole wearing a diaper thing. But wearing Depends was actually not too bad. Loved it. And then with the Depends, I would use those pads that you break and shake and they become cold, like ice cold. Ice pack pads is what I'm going to call them, I guess. Those were awesome. They would help with healing down there a lot. So basically, this is what my routine was. I would go to the bathroom, and then I would get my peri bottle that the hospital gave me, fill it up with warm water, and I would just, spray myself down.
Post-edit. So somehow I forgot to mention while I was recording this, it was the whole point I mentioned it in the first place, that the peri bottle from the hospital is totally fine. I remember seeing so many ads of these fancy, pink, cuter peri bottles that have a bent nozzle. If you want to get that, that's great. But I decided to just try the hospital peri bottle, and it actually worked great. I remember being really frustrated with it for the first, 2 weeks. But then after a while, I realized that the little nozzle that you screw on, the holes in the nozzle are actually angled. So when you spray the water, it actually sprays the way that you want it to go. You just have to make sure that you're holding the bottle the right direction, and it works just as good as probably what you would buy for $15 online. So just wanted to say that because you don't have to buy something. If you want to just use the hospital one, it works just as good as anything else, honestly.
And then I would use a witch hazel pad and just kind of dab down there really gently. And then I would spray Dermaplast on it. Dermaplast helps with itching and soreness and inflammation and stuff. And then on my Depends, right, my woman's diaper, I would put the ice pack pad And then on top of the ice pack pad, I'd put witch hazel pads with extra witch hazel, going crazy with the witch hazel. And then sometimes I'd put frozen witch hazel pads on it as well, but that was a lot of work. And honestly, the ice pack pad did plenty. But yeah, so that was what I did. And I would put it on and it would feel really good. And then I would change it every like 3 hours, 2 hours. So that was kind of my care routine. And that wasn't as bad as I thought it would be. I remember like hating the fact that I had to make going to the bathroom like a 15-minute ordeal, like just to go pee. Like it would take me forever to rinse and then spray and do all the stuff, And it's possible that my routine took longer because I tore in 3 different directions, but like it was fine and I healed up really well. So that's what was helpful for me. Okay, so getting back into the anxiety, I would have a lot of stress flashbacks. I'd get super worked up and scared and embarrassed about my experience giving birth. I think I've said this before in an episode, but I remember I was sitting down in the bathtub taking a sitz bath, and I was having a flashback of pushing for such a long time. And I just remember my brain like distorting what it thought I looked like while I was pushing and thinking, and I just remember it feeling like I looked terrifying and scary and alien-like. And I remember being so scared and anxious about what Drew saw as I was doing that. And I'm being very vulnerable here because this is kind of honestly scary to talk about and just put out there. But that was what was really hard for me. It was just thinking about what my husband saw as my brain thought I looked, like an alien. Like it really felt like I looked really scary. And I think it's because I was trying to imagine what I looked like, but all I remember was the pressure and the blood in my face from pushing so hard. And so that was just really hard for me. I remember my mom coming up to me and doing her best to like help me. And I'd say if I learned anything from that, it's that it's really good to tell yourself, it's okay, I'm feeling these feelings, and it's probably irrational, and I need help from somebody, and I need to talk to the person that I'm worried about. So I think I stressed about that and had flashbacks for probably 3 weeks before I finally went up to Drew and said, so, like, do you remember what I looked like while I was giving birth? And was it scary? I remember just straight up asking him, what did you think? And honestly, his answer was so good. And I just want to share it with all of you because hopefully if any of you still feel this way about your birth experience, and if you had something similar like that, maybe his answer will be helpful to you. It was certainly helpful to me. He said, well, when you watch someone run a marathon, they don't look good. They actually look horrible. And he was like, but it isn't a bad thing. And he said, for me, it was I was cheering you on. I was watching you run a marathon and I was so proud of you. And I was cheering you on and helping you get through something really difficult. And it was beautiful and you are beautiful. And I just remember crying to him and having this huge feeling of relief. Of course my husband sees that I'm beautiful, even when he sees me looking like a purple-headed pushing alien. Because that's what it felt like, and I'm sure it actually wasn't like that. But so just know that the people that you care about, if they ever, watch you push and it's a hard experience for you, and I'm not saying that it will be. If you haven't given birth yet, it doesn't mean that when you push, it's going to be like that. It just was for me. There's plenty of people who experience pushing in a very beautiful, wonderful way. I hope one day to be able to do that. Anyways, if that's your experience and it's really hard, know that you are beautiful pushing even if you look horrible. Because you're running a marathon and you're not supposed to look beautiful while you run a marathon, right? You're supposed to look exhausted and triumphant because that's what it is. You are exhausted from working so hard, and that is a beautiful thing. So that was something that helped me, and I'm hoping that will be helpful to you. If you have anxiety about that or have been anxious about it, remember that. Remember that you are beautiful because you are exhausted doing a hard thing, and that is a beautiful thing. And what you look like does not determine what people think of you. It does not determine who you are and your capabilities. Okay, so that's that story. And then just like anxiety, I would say it continued like it did before I had Janie. Afterwards, it just continued, right? I was constantly overthinking every single interaction I had with people. I was worried that I was annoying. I was worried I was disrespectful or asking too much. And a lot of the times I would struggle to ask for help. There were so many different times I would try and ask a friend for help, but I just would feel so awkward or rude, or the way I would try to say it would just come out so weirdly. And then I would feel so horrible about my experience in trying to ask them for help that I wouldn't ever actually ask them for help when I needed it, because I would just think that they hated me after that. And I would think that they probably were judging me. And let me tell you right now, they weren't. And they were genuinely wanting to help and wanting to love me and genuinely wanted to help and were wanting to be there for me. And I just, unfortunately, because of my anxiety, I just never let them help me, which is really sad. So yeah, I just would overthink it and I'd ruminate. My brain would make up and play stories in my head about what these people thought of me or what they were saying behind my back. And because of that, I avoided being friends with people because I got afraid that these stories were real and that they actually thought these things about me, which I'm sure they didn't. So that was something that happened for like probably 5 months after having a baby. And then, of course, there's all the new parent anxiety, right? Like, I was so terrified about putting my baby in a car seat, about safe sleep. I was checking on her every 20 minutes in the middle of the night because I was so scared she wasn't breathing all of a sudden. And same with car seats. Like, I hated having my baby in a car seat for longer than an hour because I would be so scared that she was going to die in her car seat. I was scared about the temperature. Like, my baby monitor has like a temperature gauge on it. And we were in an apartment that didn't have air conditioning, and it would often get, up to like 76, almost 80 degrees in our house. And I'm sure Janie would have been just fine. But anytime the temperature of my apartment got over 75 degrees, I would panic, thinking that my baby was going to overheat. So I'd go in her room and unswaddle her or, try to turn on the AC higher or whatever it was. And it would just... it made it hard for me to relax because I was so afraid that she was going to overheat. And then, of course, I was super anxious about her poop, which ended up being a good thing in the long run because she actually ended up being allergic to milk. And we did find blood in her stool multiple times. And so that paid off. I would have lots of anxiety about people holding Janie. I was so scared that she was going to get super sick or that they were going to drop her or that they weren't going to be able to meet her needs.
Post-edit, I realized that I didn't mention something that I think is the real reason why I struggled so much with other people holding her. It wasn't so much that I was worried that they were going to drop her, but it's more like I was so incredibly worried that she would forget who her mother was. I was so scared that letting others hold her would prevent her from remembering me and preventing her from knowing that she loved me and that she needed me. And because of postpartum anxiety, I also just after a while would start to panic. It was almost like, this is a weird way to say it, but when you have like, if you're like addicted to something and then, what is that called? Withdrawals, yeah. I'd have Janie withdrawals. And I don't know if this is like a postpartum anxiety symptom or if this is like for real, but for me, I just couldn't handle allowing Janie being held by someone else for too long because I would get scared, panicky, jittery, like I'd have anxiety about it. And so yes, maybe I was afraid that she'd get sick if someone else held her, but really it was that I was so irrational about thinking about my bond with her, and I was so scared that if other people held her too much that she wouldn't know who I was, that I just started to panic a lot. So that's something else that was really prominent in my head at the time.
And so I was just super anxious about that. And then I was also worried that people were wearing products that were going to hurt Janie, like their perfumes or their face creams or whatever. Like, I was so scared that was going to like make Janie's eczema like way worse because she does have eczema. And I just was so anxious that I couldn't function without being a stress ball. And that was always putting me over the edge. It was super easy for me to start crying around people, and I constantly wanted to, like, if we were visiting people, I didn't want to be with them for too long. And I also needed breaks. Like, I would take me and my baby and go hide because I just couldn't handle being around other people because I was so scared of all these things that were honestly probably not a problem. And I'm going to say, if you struggle with those things, it's okay for you to set boundaries, because maybe for you in that moment, even if it's irrational, it's what you need. You need to feel safe, and you need to feel like you're in control, because when you're an anxious person, if you don't feel those things, you're going to, like, you spiral. At least I did. I remember there were a couple times where people being very helpful and very kind would be doing something to help me, and I would almost panic and be so scared and start crying. And even though they were being helpful and doing literally nothing wrong, it just wasn't what I needed because I was just so anxious.
Post edit. For those listening who helped me postpartum or are going to be helping someone postpartum, you're probably wondering at this point, like, okay, well then how in the world am I supposed to help if everything I do is going to be stressful? And in my experience, this is the answer. Just give the help, and then as you are helping, check in with how they are feeling about the help and see if it's helpful for them or if it's stressful for them, and then adjust, right? Like, let's say you're holding their baby so that they can get some chores done. Maybe after 10 minutes, you could say, how are you feeling about my help? Is my help helping right now, or do you think it's stressful? And you could even tell them before you start helping that you're going to do that, so that they know that you checking in isn't you saying you don't want to help, it's just you making sure that they're comfortable. And the reason I share this is because for some reason, when people would ask me if the help they were giving was helpful or if I needed my baby back, it comforted me, and I suddenly felt way more at ease. And it actually helped me to accept the help that they were giving me for longer. And it's probably because I knew that that meant that if at any time it wasn't helpful, if at any time I felt like I did need my baby back, I knew that they would be comfortable with me asking them for my baby back, or comfortable with me asking them to adjust the way that they were helping me. Because a lot of the anxiety came from, like, oh, I want my baby back, but, like, I don't know how to ask them, and, like, what if I want her in 10 minutes, but, like, they're playing with her and don't want to give her up, you know, which is silly because it's my baby, right? It's your baby. Like, you can say what you want and get your baby back if you need, but it's still sometimes awkward and can be hard, even with your own family, right? And so I think really what helped me the most was when people would come up to me holding my baby because they were helping me and saying, let me know if you need your baby back, right? Like, I know I've been holding her for a while. Let me know if you need your baby back. And every time they'd say that, I'd be like, oh, no, actually, you can keep her. And that was because it helped me to see, oh, like, this person is willing to adjust the way that they're helping me based on my needs. So, yeah. And then if you're the person who's postpartum and you're trying to figure out how to set a boundary with this, something you could do is just say, hey, I've noticed that when you help me, sometimes I get stressed because the help that I need might be a little bit different. Is it okay if after you start helping me, if in 10 or so minutes I come and check up on you, or you come and check up on me and see how the help is working? And I promise you, pretty much everyone is really nice and understanding, and they'll say, oh yeah, of course. And that's something that they could do, is just come in, check in, see how you're doing with the help that you're giving them. And I'll say this is honestly the case for anybody who needs help, not just those who are postpartum, right? If there's someone who's recovering from something or is super stressed with schoolwork and you're helping them with something, I don't know, like anything that anyone needs help with that they're overstressed about, if after helping for 10, 15, 20 minutes, they still seem stressed, you could say, hey, is there any other way I could be helping you that's more helpful right now? And if not, then I'll keep doing what I'm doing to help you. But if there's something else, like, I'd love to help you in a better way. So anyways, that's my little 2 cents on that.
As you can see, like, obviously I had quite a bit of anxiety, right, postpartum. It's funny because I never considered the idea of going to a therapist for my anxiety, which is so weird because I literally spent 4 years of college learning about how therapy can help with anxiety and medications can help with anxiety, but I just didn't even think about it. And I think it's because when you're in it, you don't think about things like that, right? You have to prepare for those things beforehand, or be thinking about them beforehand, and then ask someone else to watch for those signs for you, and then be willing to pull you aside and say, hey, like, maybe you need extra help. And I think the biggest reason why I didn't go see a therapist was because in my mind, at that point, therapy was for depression, and I was so good at, like, trying to manage my my postpartum depression that I was like, okay, like my postpartum depression isn't that bad. Like I probably don't need to see a therapist. And if I'm being honest, I don't think I needed a therapist for my postpartum depression, but I do think I needed a therapist for my postpartum anxiety. And I just, because I had never thought about postpartum anxiety before, I didn't even think about a therapist at that point. And a big part of me was like, it's not that bad. Like, I'm not really that suicidal. And for some reason, I was like, I don't need to go to therapy unless I'm suicidal, which is like not true. And I mean, I had one or two suicidal thoughts postpartum, and that was honestly really scary. I never had a plan or anything. I just would have thoughts like, well, maybe people would be better off if you just weren't here because you're making a mess of things. And if you are experiencing thoughts like that, please tell someone, and please consider therapy or just asking someone to help you kind of get out of that thinking, even if you know what you're thinking is wrong. Because that was my like, oh, I'm fine. Like, I know that what I'm thinking is suicidal, and I know that that's not good. And so because I know that, it's not a big deal. But I don't think that's helpful. I think it's more helpful to say, hey, friend, like, I had these thoughts, which means I'm probably a pretty sad person. I would love if you could help me. Like, that's probably a better answer. Anyways, so I think it was because I was so focused on the depression part that I wasn't thinking about asking for help with my anxiety. And so this is where I want to introduce an app that I was given a free trial through my pelvic floor therapist. It's called Curable. This is not sponsored. It would be cool if I was sponsored by them, but I'm not. Curable is a mindfulness app that focuses on meditation and mindfulness for chronic pain. And it's interesting because this app is super helpful if you are feeling chronic pain in your back. Or for me, this injury that I'm talking about with my pregnancy, I had gotten it almost 2 years ago at this point. For me, I think it's almost 4 years this August, and I'm still struggling with it. And at this point, I am totally healed. Probably, right? Like, every time I've gone to see my pelvic floor therapist, there's obviously some tightness and stuff, but the actual injury itself isn't a problem. It's more that my central nervous system basically is super heightened. I basically have an anxious nervous system, right? And actually a lot of people do. And this is actually what chronic pain is. Chronic pain is when, this is the best way I can explain it. You have an anxious nervous system, and so even when you don't have pain, your body reads certain things as pain because it's trying to be super extra careful. And Curable is a way for you to kind of take control of your brain and say, I'm not in pain, actually. And it kind of helps you to kind of get into that mode of having mind over matter, right, is basically what it is. And I was a little like, it might help. But I decided to go for it, decided to take it seriously. And this app is really, really helpful, really, really cool. It educates you and then takes you through different mindfulness practices that helps you to overtake this pain. And if you were listening to my previous episode, I had talked about my milk bleb and how painful it was. I actually was using Curable at this time and decided to use some of my practices while I was nursing. And even though I had my milk bleb, there were quite a few times where I was able to totally turn off my pain while I nursed. It was really cool. And I was able to just tell my mind, like, nope, I'm fine. Like, it's just a little bit less comfortable than I hope it would be. And because of that, I was able to really, feel comfortable nursing, even though I was in pain for real. So if that's something you're interested in, I would go check it out. Wrapping up here because it's almost been an hour and I just realized that. But it wasn't until I was 3 months in that I finally realized that my postpartum depression and anxiety, and it was probably more anxiety, was a problem enough that I needed help. Like weekly help, not just help once, but I needed a scheduled routine help from someone. And I was trying to figure out how I was going to do this. And I remember praying, and I think God was like, you have 2 moms that live 30 minutes away. And so I was really scared asking for their help because I don't know, I think in today's society, we're just told that to be a good mom or to be someone who can handle themselves, right, you have to be able to take care of yourself. Like if you're going to be a good mom, then you should be able to take care of your home and be postpartum and take care of your baby all by yourself and only need help the first week. Like you only need help postpartum the first week. That's what society, at least That's what I felt society was telling me. And I'm here to tell you, maybe that's not true. Maybe we can be good moms because we're getting help, right? And I know for me, like, having my mom over every Thursday and Drew's mom over every Tuesday was so incredibly helpful. I could clean the house, I could move my body, I could go shopping, and Janie got to spend time with her grandmas, and she got to, like, actually bond with her grandmas, which is really, really neat. And it's actually cool because even right now, even though Janie is almost 1 year old and I'm doing eons better, this routine is still in place. It doesn't happen every week, but most weeks, more than not, my moms come over and they come help with just being with Janie so that I can podcast, actually, which is awesome. And I'm just really grateful for them. So maybe this is something that you decide to put in place a couple weeks after you observe your postpartum situation and see if it's something that you would want. And I will say it's okay to want this and not need it and still have it. Does that make sense? Like, you don't need to be desperately in help to get routine help. If you just want help just because you want it and you think it would be good for you and good for your baby, then do it. So there you go. That helped a lot. And now I'm going to finally share the things that did help me. They are simple primary answers. And it might feel unsatisfactory for you, but please take these things seriously. It's kind of like in my church, in the Church of Jesus Christ of Latter-day Saints, we're always like, what's the answer? And we're like, prayer, scripture study, go to church. Like, those are like the 3 primary things. And it's like, okay, whatever. But those things are actually what Jesus asked us to do, right? And so this is what I'm asking you to do and what helped me. And I think what helps a lot of people, number one, and I've talked about this in other episodes, go outside. I don't care if it's snowing or if it's windy or cold. And I'm honestly talking to myself here. Camille, go outside, for goodness gracious sake. Because going outside means you're going to be moving your body. And going outside and moving your body and feeling the sun on your face, feeling the wind on your face, gets you out of the isolation that the indoors can bring sometimes. And it gives you endorphins and chemicals such as BDNF that you can't get anywhere else that repairs your brain chemically and physically and, of course, metaphorically, mentally. So move your body, go outside. And then, of course, other things that have helped me a lot that I wish I had done sooner was getting friends over to play with Janie and to talk with me. I remember I had my friend Alexi finally come over, and she brought her baby, even though he was like a whole year older than Janie. And we just hung out, and it was amazing. And I remember her leaving and being like, I want to do that every single day. Why have I not been doing that sooner? So definitely try to set up talking to your friends, getting them over, Marco Poloing your friends. If you have Marco Polo, if you don't, FaceTime or get Marco Polo. Again, not sponsored, but it's cool. And then, of course, things that help are getting more sleep. And even saying that now bugs me because you can't really control how much sleep you get. Like, you can't. Your baby's temperament, as well as your decisions with sleep training, are going to adjust how sleep is going. So maybe that means you need to try to nap throughout the day or whatever it might be. So getting more sleep definitely helps. And then I will just say time. Meaning, like, it just takes time to recover from giving birth and from being pregnant. Having all those hormones. Some people's bodies, it only takes a month to recover. Some other people they've had evidence of pregnancy hormones lasting for up to 2 years in the body. And sometimes it just takes a long time for bodies to regulate. And so just remember, wherever you're at, as time goes by, things will get better. Continue to make choices that will help you, such as going outside, moving your body, eating healthy, talking with people, and doing what you can to try to nap throughout the day or whatever. So one other thing that helped me that I don't think is a primary answer for this, but was somewhat helpful to me while I was struggling with anxiety and depression postpartum, was tracking everything, which I don't think is good advice if tracking things gives you perfectionism, because then not tracking things will probably make it worse. I don't really struggle with extreme perfectionism too much. And honestly, just writing things down that I did helped me to feel productive. So the app that I used was Huckleberry. Again, not sponsored, but Huckleberry is a really easy app that you can track diapers, sleep, baths, playtime, tummy time, medicine, everything. You can track everything with your baby. Skin to skin, right? You can just like put timers on for all of those things. And for me, when I did that, it helped me to see that what I was doing is a good work. And it is work, and it's an important work, and I'm not being lazy. Because it was easy for me at the very end of the day to think, wow, like, I like sat at home and watched a baby that just lays on the floor all day. Like, wow, I'm so lazy, you know? And then I would get down on myself. But it was when I would record, like, wow, like today I changed 10 diapers, and I did skin to skin for 30 minutes, and I fed her a billion times for however many minutes, and I did playtime with her, and I took her outside, and I gave her a bath all in one day. And I'd be like, wow, like, I'm not being lazy. Like, taking care of a child and yourself postpartum is a lot of good work, and it is a divine work. It is a work that allows the human race to continue on, to allow God's children to grow and become. And so that's kind of where I want to close, is what you're doing is good. And when you're feeling these anxious feelings or depressed feelings, whatever the case, remember that what you're doing is good. And a scripture that I wanted to share is in Alma 7, is verse 15. It says, I say unto you, come and fear not, and lay aside every sin which doth easily beset you. For context, this is right before describing what I just read. It talks all about how Jesus suffered for us, he died for us, he felt everything that we went through and has saved us. And so because of that, he's saying, so come, fear not, and lay aside every sin. And I'm going to add, lay aside every anxiety, every sadness, every struggle that you have, right? Every frustration. Lay it on the Savior, lay it on me. And go forth and be willing to show unto your God that you are willing to repent of your sins, or willing to try to be better, or try to heal from the things that you're going through. And by so doing, God will remember you, and he will help you, and he will strengthen you. That's not everything that this verse says. It talks more about baptism, but I think that it's still applicable, right? As we remember God, as we give him our fears and our struggles, our frustrations, our anxieties, our depressions, as we give him those things, pray to him out loud and ask for help, and then keep doing what we're doing as mothers, he's going to help us, and he's going to make sure that we make it through. So I can testify that that is something that has helped me. I actually earlier today was reading in a journal entry at the very beginning of this journal. It had been 3 months postpartum, and I was writing in my journal and saying, you know, I haven't prayed out loud in months, and I'm finally going to do it. And so I prayed out loud, and then I wrote down what I felt God was telling me in my journal. And it was really, really helpful, and helped me to see God was there for me. He helped me, and he loves me. So I just invite you to lay aside every struggle to God, pray to him out loud, and trust that he is there as you continue to learn to love motherhood, if you don't already. And I say that in the name of Jesus Christ, amen. Thanks for listening. I hope this was helpful. It felt a lot better than last week. Last week I was kind of foggy in the brain, so sorry about that. But to end, text a mama that you're thinking of. I say that every week, but I really think it's a good thing to do. If you have a mama that you're thinking about, go ahead, text them, call them, tell them that you love them. And with that, I will see you next week.